What's up, you guys? Hey, Chad back again. Dr. Rizvi here, of course.
Hey, guys.
Today we're reacting to something that I found on the internet, and everything that you find on the internet isn't necessarily true. So we'll see what you guys think, see what the foot doctor thinks.
Maybe it is true. We don't know.
Maybe it is.
Maybe it is true. Let's find out. That's what we're here.
All right. This is Fungus Key Pro.
And why, if you have toenail fungus, you may be dealing with something much more alarming than the poisoning fungus itself.
Poisoning
Please.
fungus.
Poisoning
This
fungus.
special report contains highly sensitive information
Oh,
and
okay.
complete truths about toe and nail fungus. But also
Highly
why
sensitive
and
information,
how
folks.
a
Interesting.
tiresome condition medical research thinks is incurable.
Special management
Okay,
technique.
okay. I feel like we should chime in already because
Let's jump in.
they're already saying that it's uncurable by medicine. Like that, he literally just said that.
Yeah, I mean, I guess he could get a... It's hard to treat. I
Yeah.
guess he's trying
Yeah.
to make it seem a little worse than it is, but it's hard to treat. It's treatable. It's hard to treat.
Yeah,
It's-
and he said they've got the answer.
So that's
not
what
like
I mean.
an answer.
That's why I
so.
want to know, because I want the answer.
I guess.
Matt Stevens, a 53-year-old
Here we
tax
go.
consultant from California, thought toenail fungus was nothing serious. Yet there he is in intensive care, barely recovering from blood poisoning, with oxygen tubes inserted into his nostrils and being pumped with antibiotics. The doctors told him
What?
that they brought him in with a severe fever, 103.5 Fahrenheit, after he fainted on the sidewalk. And fortunately for him, he wasn't one of the 40% who died because of blood poisoning or septicemia.
But he didn't get that from his
Toenail
nails.
fungus had destroyed his health over time.
Nope.
Slowly chewing away his immune system.
Nope.
I thought we were talking about toenail fungus here. Oh, okay, we gotta pause right here. This silent killer. I
No,
feel like
it's not going to kill you.
yeah, you've said that to me before. Toenail
Yeah.
fungus is
It won't kill you. I mean, it's going to get worse and
right.
harder to treat, but it will not kill you. I can
I
promise you that, actually.
yeah, and I have never heard of somebody going into the hospital. He needs a breathing tube, do they say? And he's no,
Like a nasal cannula. Yeah, nope.
no.
But I mean, let's meet this guy that you know.
Oh.
You have a weak immune system that attracts all sorts of illnesses and diseases like a magnet. If you are older than 50, like disease.
Well, I mean, this part's not wrong. You're more prone to fungus if you're older, diabetic, patients that are very active,
Yeah.
just because of the nail trauma. So you kind of mentioned that part.
Yeah.
So you got to give him credit where credit is due.
Okay.
He's right there.
All right.
For you. It could even turn up on your face.
Nope.
Ugly scars that never heal.
You cannot.
Fungus can jump on your- What?
And include very severe pain.
No. You want to have diarrhea, vomiting, fever.
From fungal nails.
Grinds
This
down
is-
your immune system and opens the way to deadly diseases like meningitis
No.
or necrosis.
Necrosis is more of your
Consumes your skin and tissue.
your blood flow,
Enter the
not your
bloodstream.
nails.
And next thing
Okay.
you know, you will find yourself lying in a hospital
Oh
bed.
my gosh. Oh, here he is.
My nail, I wouldn't leave the office for 2 or 3 days, and I could see that the infection was spreading.
Okay, this guy.
You wouldn't see the infection spreading in 2-3 days. Maybe like in a over course of a couple of months, but not 2-3 days.
Yeah.
After he recommended Lamisil and
Okay, Lamisil, pretty common treatment. We don't recommend Lamisil.
Again.
Yeah, hopefully he mentions this, but it's kind of hard on your liver. So you gotta do a liver test before, during, after. But he has not yet. Okay, maybe he'll talk about it. Yeah, side effects. He mentioned side effects.
Fever, joint pain, sores in my mouth, losing weight, patches on my skin that were turning purple, stomach pain.
I don't doubt that he had fungus, but he also has something else going on because all these symptoms he's describing are not from fungus. Hopefully they did a full body examination on this guy because it sounds like he has other stuff going on. I mean, fungus certainly is. It can be painful, you get infections that way, but nothing like the diarrhea, vomiting, systemic issues that he was describing, fever, you wouldn't get any of that.
All right, so we're not going to be able to react to this entire video because it's over half an hour long, and
Hey, but it's pretty entertaining. You sure you don't want to watch the whole thing?
here is the second interview, Mr. Jason Bridges, age 21. Here we go.
Say his name.
Right. I guess I must have mashed it up against something.
That is true. It's trauma is a big reason for fungus. So I think it's a top one. I know it's a top one. I should say. Very common, very common.
Okay, it sounds like he's reading this. Does it sound like he's reading this?
Now I see emotion in his voice.
something became very wrong with me.
Yeah, no,
And
that time,
Though
yeah.
I should have been
He's
happy
reading.
that the treatment was working.
Yeah, he's reading this.
Yeah,
He's reading
yeah.
this. And
That's
this-
not how a
and it's-
21-year-old talks.
And this is the first time he's reading it, too. It's not like he's seen the script before.
First of all,
Right.
was the fact that I had
His eyes are scrolling across as he's, yeah.
It's unheard of for a college athlete, right? I just couldn't perform anymore. And
The other guy was a little bit halfway believable.
Yeah, and that guy was actually good. This
my life would have been over.
Who talks
Wow.
like this outside of a Disney movie?
Not focus on anything at all.
I don't know what Disney movie you're watching, but the ones I watch are not. They don't have this.
They're not about
subject topic.
toenail fungus?
They're not about or this guy's problem.
Oh, yeah, yeah.
The news struck me like lightning. I thought
The
that
news
nothing was
struck
over.
him like
And
lightning. Very nicely said, my friend.
Maybe this guy's a writer, you know? That just feels so fake. But maybe
No, none of
it's
that is
alright.
true. None of that is true.
So I tried to find it on YouTube, because on YouTube
we
you can
can, like,
scroll back and forth. On YouTube I found a couple other videos that are not this video. I couldn't find this video. One of them is this.
Why is he in the OR?
Is an alarming condition in our country.
He's in it.
Americans are facing an epidemic. What people don't know is that unfortunately modern treatment options can become very dangerous, and most patients don't really have a viable option. Your treatment, to be honest, was a much welcomed shock. This kind of cure humbles modern medicine. I hope you get the message to as many people as possible. Your documentary is the first step I ask my patients to watch when they come with this problem.
Look at this guy though. Look, he's definitely like way lower quality than the background.
Oh, you think that it's the background?
This is
fake?
green screen for sure.
That's
this is green
amazing.
screen.
I was gonna say, why is he in the OR? Like,
And the lighting is off a little bit. This is just me because I make videos. But yeah, and the angle is off a little bit. The camera angle on him and then the camera angle in the room is
I did not
doesn't
see
match
that.
up.
I
It
did not
doesn't
see
match
that.
up.
I think he did a.
So let's say I'm wrong. Let's say he is Dr. Joseph Bradley, MD, Seattle podiatrist, and this was posted in 2016. You should be able to find Dr.
Yeah, of course,
Joseph
because they're
Bradley
on the internet,
in
yeah.
Seattle, right?
Yeah,
Absolutely.
in theory.
No. Do a quick Google image search for Dr. Joseph
A
Bradley,
urologist
Seattle.
is a urologist, PhD.
But
Not
does
this
anybody look like this guy? No.
guy. No.
This guy, okay, so we're past just like
That's a fake.
possibly impersonating patients. He's impersonating a doctor to promote this, this service. And
He wasn't even like a good actor. Like,
No.
if they were gonna hire somebody,
he's doing the cheesy, like super emotional
and they had the
read.
music in the background,
Yeah, the
like
music
the
was just
dramatic music.
hokey and cheesy. So I've watched to the end of this video.
You really have to watch 30 minutes of this.
Yeah, well, you have to watch at least like 5 minutes before it gives you the option to add this to your cart. So
What is it? Yeah.
it wants to sell you this ebook situation, which has a bunch of home remedy things, and it's $37.
$37.
But this is the
Yeah,
ebook.
you found
here.
the book, or?
Yeah. So it's basically a bunch of home remedy things for fungus.
But
But
like, what are the topics? Lemon juice, olive oil, garlic mix, grapefruit seed extract. Tree tea oil is the only one that I've heard of. Acetic acid, fermented alcohol liquids, apple cider vinegar.
and they're saying it's the most powerful only way to get rid of
Chapter 1,
toenail fungus.
the war.
The war. So, and later on in this video, it describes this Dr. Wu Chang, and he's got some, experience from treating patients in the Vietnam War, blah, 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 whatever.
Yeah.
And it's very scammy. And turns out there's several articles out now that this is totally made up, that Dr. Wu Chang doesn't exist. So don't believe everything you see on the internet, right?
We learned that. Because Chad didn't know that before. He learned it the hard way.
Right, had to learn
For
that the hard
Fungus
way.
Key Pro.
Yeah. Oh man. But yeah, like you said, our laser by itself is over 90%
Yeah,
effective
it's very
at
effective,
killing the toenail fungus, and then in conjunction with topicals, like you said, and everybody
Works really
that's
well.
Yeah, so if you want to see some real actual results of getting rid of toenail fungus, head to heartlandfootnankle.com and check out some patient testimonials. And skip Fungus Keep Pro.
Fungus Keep Pro.
Don't buy this. You don't need to buy this.
All right, guys.
If you liked this video, us debunking some fake foot treatments, then let us know with a big thumbs up. Let us know in the comments down below, so we know what you guys like and what to make next.
Yes.
So thanks for watching all the way to the end. Appreciate you.
Bye, guys.
We'll see you guys next time.
Got some lemon in the top right. I didn't notice that. Cut up lemon. What's the picture? What's that? That fruit? What's that? Vegetable? What's that right there?
Yeah, and we got 2 pictures of like
Some salt? Is that salt?